For the millions of seniors and people with disabilities who rely on Medicare as their health insurance, the future looks cloudy. When these patients need care, Medicare pays their physician. The government pays doctors using a formula called the Sustainable Growth Rate, or SGR. But the SGR is flawed, so physician fees have been scheduled to be cut almost every year for the past decade. And only emergency patches by Congress have stopped the cuts.
The patches that keep happening at unpredictable interviews have made an already chaotic system even worse, and have made Medicare completely unreliable as a source of physician payment.
Here's what the Medicare SGR formula looks like. The complex equation counts factors like the U.S. gross domestic product, but it ignores even more important elements like how much it actually costs doctors to care for patients. Under the SGR, Medicare payments to doctors aren't keeping pace with costs. Look at the widening gap on this chart. The top line is Medicare's estimate of how much it costs doctors to run a medical practice, while the red line shows what Medicare pays physicians.
For a long time, we've been enabling that system by continuing to do what's right for our patient and continuing to take care of the patients, even though we were technically paying money to provide that service. And there's just a breaking point at which that can't go on any longer.
If you can't provide enough income to offset the cost of manufacturing the car, you don't make the car anymore. So in our situation, things have got to change, especially in the Medicare arena, or we can't go on.
TMA surveys illustrate the problem. Medicare cuts force just over a third of physicians to limit how many new Medicare patients they can see.
And with the help of doctors here in town, it still took me a long time to finally find somebody who was willing to take me as a Medicare patient.
Long term, it's going to affect every patient, not just Medicare. Long term, if your doctor can't balance his practice and keep it open and healthy, he may not be there for you even though you're 35 years old.
The new health system reform law ignored the Medicare problem. So earlier this year, the Texas Medical Association created a grassroots initiative to stop the Medicare meltdown. Physicians and patients across the state have signed petitions asking Congress to replace the SGR with a rational Medicare physician payment system.
We're just asking the government to fix a problem they've had an opportunity to fix for 10 years. I'm not blaming one party or another because both parties have had an opportunity to fix it and haven't.
Now TMA's Medicare Meltdown push has gone nationwide. All 50 state medical societies have joined in. Across the nation, patients and doctors are calling for a permanent fix to the Medicare funding problem.
Surely everyone in this room has signed our petition to stop the Medicare meltdown, and we will get 1 million signatures.
And I think what should happen is the folks who are out there who are receiving Medicare should individually contact their members of Congress, both the Senate, which is more important right now, and the House of Representatives, and say, look, I want this system fixed so I can have access to a doctor. I didn't pay into the Medicare system with these extra taxes all these years to have you tell me, whoops, it's all gone. And I think the federal government needs to step up and solve the problem.
Please join TMA's effort to help stop the Medicare meltdown.